Susan, I'd like you to talk a little bit about how do you sort of figure out which of these sectors is most important to invest in from a financial standpoint? As you work with hospitals and with patients on the ground level, where do you see the most investment potential from the private sector?
Well, in our experience, I'd say that the projects that are most successful are those that start with bringing together community stakeholders, residents, elected officials, public health department, all the major players, to first of all assess the need in the community, and then to prioritize it. And from that common base to move forward with a particular project. And you know, there's one under development in central Los Angeles now that I think is most likely to be one of our most successful. It's in a federally designated medically underserved area, sort of in between the gentrification of downtown LA and where the homeless encamp. And it will be a transit village near public transportation. It'll have 140 apartments for low-income families and seniors and persons with disability. And there'll be a community health clinic on the ground floor together with retail establishments serving the community. So when you put all of those factors together and provide the service-enriched housing that allows for a coordinator to actually hook up a resident with the particular health or social services that might enhance their lives, I think the chance of success is monumental.
But why should health and healthcare be sort of the organizing principle of these investments? Why not say these things are helpful for education or make public safety or security the most important organizing framework? What makes health so important as the main thrust?
Well, in many communities, if not all, the hospital tends to be an anchor institution. We've been there for decades. We employ from the community. We have relationships with the community, and we, like everybody else, recognize that health doesn't happen in the hospital ER or the intensive care unit. Health happens in our homes, our schools, our communities. So we want to devote as many resources as we can to promoting that kind of broader health of the community. And that's why from our very beginning in 1986, we've had a community investment fund where we allocate $80 million a year across our system to provide below market rate loans to nonprofits that are filling in all the social determinants that we've discussed here: housing, education, job creation, and training. What we're trying to do is ensure that where the community-based health clinics are, there's also dental care provided as the earliest predictor of poor health and the first intervention that can eliminate need for much more medical care further down the road.
Susan, any investment requires some risk-taking.
Yes.
What happens when a project doesn't work or an effort either isn't providing the social return or isn't providing the financial return? What happens then to both the initiative and to the community?
Well, you know, in our experience, and we've been at this since the early 1990s, we've lent out over $137 million, and the default rate on that is 0.4%.
Wow.
$540,000 on 2 loans that we had to write off. Now, that's not to say that we haven't been patient lenders. And some of those
What's
loans
the average loan term?
have been on the book for a very long time. We've had periods of 0 interest. But I think the perception is that lending in low-income communities is a lot more risky than it actually is. And I would encourage people to take a careful look at that. Look at the community financial development organizations in your community, and they have the same kind of record that we have. Again, you might need to be patient, but the nonprofits and the community members are so invested in their communities that they will ultimately come through, is my experience.